Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor of Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Mark Mabus. He's a CMIO and VP of EHR at Parkview Health. Welcome, Mark.
Thank you. Thank you. It's great to be here.
Yeah, it's great to have you here. I always love when doctors come on and that are in the trenches of CMIO work
for sure. Yeah.
and EHR work. So excited to learn from you. Before we dive into the topic today, tell us a little bit about yourself and Parkview Health.
Sure. I'm, like you said, Dr. Mark Mabus. I am family medicine and clinical informatics boarded. Been working in practice for over 16 years. And that has primarily been with Parkview Health, which is based in Fort Wayne, Indiana, has 16 hospitals servicing Northeast Indiana and Northwest Ohio. Personally, became CMIO at Parkview, a few years ago. I've also kind of leveraged some things in that realm to also connect with the CMIO community and through Epic Systems, our EHR vendor, where I sit on their Physician Advisory Council. I'm also part of their Cosmos Governance Council, and last year also was voted their Physician of the Year. So I'm very humbled and thankful for all those different things that I'm able to do to help providers in their day-to-day jobs do things better within the EHR.
Yeah, that's awesome. Well, it's funny, we actually met last year talking about Cosmos and all they're doing here.
Yeah.
But this year, it's awesome. We're here at the KLAS Arch Collaborative conference and talking about optimizing the experience and the satisfaction of users, which I love. Why did you decide to take part in the KLAS Arch Collaborative?
KLAS Arch Collaborative has their Net EHR experience score that we've heard about from Epic for years. Epic is big on the satisfaction with their product, and they've pushed that in different ways. We did our own kind of internal survey, distributed through forums, and we're tracking it for about 5 years before last year when we joined the Arch Collaborative. That provided us some good insight, for our own purposes, where my informatics team needed to focus a little bit more on, what education methods were being a little bit more successful, but we never had that kind of benchmarking. How do we compare to other healthcare systems? And that's the beauty of the Arch Collaborative, is that they have that data for all EHR vendors, for your specific EHR vendor, for the size of your organization, breaking it down into, physicians, APPs, nurses, allied health professionals, all those different things. We wanted to see where we were at compared to everybody else. And so that we had kind of just waited for the right time. And we did that last year. And out of the gate, we scored, pretty darn well, I would say. So super thankful to KLAS Arch Collaborative for their assistance in providing that information to us. So
tell me more about that. Like, what did you learn from taking part in the collaborative, and what are some of the actions you're taking from the learnings that come from the collaborative?
Yeah. So first off, we learned that what we were doing was making an impact. So that self-validation, external validation from that KLAS was providing really helped us feel good. We hit the 98th percentile for all EHR for our system for physicians, and so that was humbling and amazing right off. This survey was actually we'd done physicians for 5 years, we'd done nursing for 3 or 4 years. This was the first time we also surveyed allied health professionals, so like your pharmacists, your technicians, your case managers. We thought, why not get them in the mix too? And do we need to do any, work with them as well? So first survey, eye-opening, we scored well, not as well as with physicians and nursing. And that just, reinforces the fact that we've put our resources into physician and nursing. Maybe that's a chance to put some more into allied health in the next year or two. Now, I would say I would use that as a challenge to other health systems too. You've probably focused on your providers in nursing, but how much have you done with your allied health professionals? So what can we do there? So I'm excited to see what we do end up doing for our allied health folks and be able to share that with the communities later on too.
It is the fascinating part about these types of surveys is that, you're in the 98th percentile for your type of organization.
Yeah.
But no matter where you are on the spectrum, every person, every organization that's part of it can still improve.
Right.
You're not at 98% of perfection, right?
Well, right. And even if you are scoring that well for physicians, who says you're still going to be there in a year? Because everything's going to change with, there are going to be upgrades and other functionalities that come. Are you going to roll them out properly? What about 2 years? What about 3 years, 4 years? So we came out of it at a high bar that we've got to maintain as well. So
that's a good point.
So areas of growth, areas of maintenance.
Yeah, I love that. In your presentation you were doing here, you talked about leveraging Epic Signal to improve your efforts. So talk to me about how you're using Epic Signal to improve patient education, to burnout, your staff education, things like that.
Signal is Epic's data warehouse for efficiency galore, basically. First, it started off with providers. Now it also has nursing in there too, but it can give you insight into different efficiency metrics that can help with workflows or maybe even just preventing burnout. There are certain metrics that have been associated with burnout. So take a look at metrics like how long does it take for you to get through your InBasket messaging? How long does it take for you to write a note? How long does it take for you to close an encounter? Numbers and volumes of messages coming into a provider versus maybe a staff person who could better handle that message. We all know that email or portal messages exploded with the pandemic. So are things being routed properly there? Is a provider doing a little bit too much in there where staff could do it? There's a lot of different ways to look at those angles, but Signal also helps you benchmark against your colleagues and others in the Epic community. So say, for example, I have family medicine. I can compare myself to the other providers in my family medicine department. I can compare myself to family medicine as a whole for my organization, but then also how am I doing in the whole Epic community too. So there's those different levels of benchmarking. We took a bunch of those different metrics and looked to see, top 10, bottom 10%. Where are those providers lying? So the ones that are doing well, you look at those workflows, see what they're doing that could potentially benefit others.
Love that.
Then afterwards, you can take that and then do observations of those that are doing, not so great, 10% at the bottom, and see where maybe some of those best practices from the 10% or other kind of general education and trainings that we know work can help out those bottom 10%ers. So sometimes it's targeted education if it's a whole service line or department that's doing not so great in that area. Or if it's individual providers, maybe you target that individual provider with individual education, like a one-on-one session customized to that metric and maybe anything else that they may be struggling with in their workflow. So we kind of set up a kind of basic template or checklist that our informatics clinic specialists go through with those one-on-one sessions, making sure they're doing everything like we have recommended, and if not, showing those different workflows. They do a bunch of pre-work so that they're ready to go at that visit, and then they have a debrief with that provider afterwards too. Those customized one-on-one sessions, they are time intensive, but they have big impact for those individuals. And so we've provided, between 100 and 150 of those sessions per year the last couple years, and really helped those providers out that way. But then also we use that information to see, like I said, is it department level education or service line level education that also needs to go out. So Signal has been one of those tools, but sometimes you just have to get boots on the ground and see what people are actually doing too.
Yeah, Absolutely. Well, and I think you're right. It is expensive, that one-on-one education, until you realize an inefficient provider is much more expensive.
Right. And an inefficient provider could be a provider on their way to burnout.
Yeah,
could
which gets even more expensive.
Right.
I hear them estimate $500,000 million to replace a provider.
Yeah, it's all over the place, dependent on specialty. But
Sure.
yeah, that's very expensive for any system.
Yeah,
So.
absolutely. You mentioned note bloat in your presentation as well. I think Judy at Epic UGM last year mentioned note bloat and some things like that. How are you approaching note bloat in your organization? And talk about some of the creative ways you're working to address it.
Sure. Yeah, note bloat, I think, if I remember correctly, has been kind of an initiative for provider efficiency from Epic themselves since at least 2019. They have had webinars on it. They had a special class formed on it too. Note bloat is the addition of additional information in provider documentation that really doesn't tell that patient's story or needs to be there to tell that patient story, but it may be in there for other purposes like billing and coding or legal stuff. Yep. So when Epic first did their things in 19, it kind of got something fired up in me that I kind of realized this is an efficiency gain. If we can get rid of this extra stuff in progress notes, providers won't be taking as much time to do their progress notes. People reading those progress notes will have an easier time too. So it's kind of that whole team approach. Yeah. And then 2020 hit, So yeah, that gave me actually a lot of time to think about how to address this. When we shifted over to an all telehealth model there with COVID, the telehealth documentation requirements are not as strict as regular visit, requirements. So that kind of sparked my interest when I was developing some of the standard notes that we used for telehealth, kind of in that emergency shutdown March 2020 thing. And then kind of going from there, because right soon after, CMS announced the new CPT guidelines for 2021, which were the first changes for documentation, billing, and coding in almost 25 years. EHRs came out and we don't change any documentation guidelines. Oh wait, we'll finally do it, 25 years later. So that was a perfect chance, I thought, to make some of these changes. People were in a different place practice-wise. I think they were more open to learning because there was a little less patient care happening that time, obviously, except for the intense stuff, in the hospitals. But
the virtual stuff.
Right. So I think all those different factors, kind of cued me into, hey, this is an opportune time to talk to providers about changing things up. Let's take advantage of it. How would I be engaged better? And I have no idea how this got into my head, but I'm like, I need to do an infomercial about this concept, because I got to sell it to providers, convince them that the way that they've been doing things is changing and it's okay to change, and it kind of, those cheesy infomercials from the 90s, that became my little inspiration. So I made a quick little video about how the documentation guidelines that were coming out could help you, and that kind of caught like wildfire. We used it as an introduction to a 30-minute CME, more traditional education about the details of all of that. But that hook, that 1.5 minute infomercial to get people excited and interested, or at least, hey, what's he going to talk about next? That was the first thing I think that sparked many more ideas for note bloat and other efficiency things that we've done kind of across the years. I did a follow-up infomercial for the 23 guideline changes for inpatient ECFs and EDs.
People always want to see the follow-up.
Yeah, exactly. If you do it once, you got to do a sequel, right? And then there were other things that we did too, as this kind of caught on and we had more education go out, multiple times. We decided to incentivize providers too in a fun way.
Oh, that's awesome.
2020 and 21 was also the time of home workouts and things like that. So everybody was exercising at home. So we did a kind of a multi-level marketing of one of those fitness programs parody, and said, if you do this, if you reduce by 10%, you get this award, 20% you get this award, 30% you get that award. So it was reducing your character count in your notes. We tracked that quarterly for our providers, and then sent out emailed certificates. People loved it. They were like comparing themselves to each other, that kind of competition.
Yeah.
And, I introduced it with like an exercise video even parody, and it was fun. So not only do we have something that's engaging and catching, it was fun, competitive, kind of that gamification element there too.
That's cool.
And then that led into, the 23 guideline changes, where not only did we, repeat some of that, we also created an escape room for a medical escape room. Yes, such thing exists. Walking through those inpatient providers on the changes that they could make with their documentation. Escape rooms are, solve this puzzle to get to the next puzzle, to get to the next puzzle, to get to the next puzzle. But you can do the same thing with like a quiz, give a quiz with multiple choice answers, and you can, figure out how that can change into like a combination on a lock and things like that. I had some great support, and that went off very successfully. Those providers that attended definitely decreased their note bloat once the documentation guidelines hit. So
wow, that's so interesting.
Yeah.
I mean, imagine that video versus what most people would do, which is send an email. Right? Like,
I know. I mean, it's the tried and true method, because there's no better way to do it than just an email or tips and tricks.
Portal.
Go find this PDF and read it.
Yeah.
I know we still have to do those things.
Sure.
But what other ways can we engage? Can we do it through video content? How do you share that video content is a good question. Do you just email it, and then, or do you put it within workflows somehow? It's just kind of finding those out-of-the-box ways for the high-impact things. Yes, there's absolutely stuff that just email and they can read it later, but is it things that need to be presented in a meeting? Is it things that you need to put in an InBasket message, instead? There's other ways of doing things, and I think as a whole, we need to be better at exploring those other options.
So, I mean, you just gave 4 or 5 creative things that you've done.
Yeah.
What would you say to people who are like, I want to be creative, but I'm scared, or my bosses, so I have to get buy-in from them, or
Sure.
What have been the results, and how did you get buy-in to allow you to do these creative things?
I think starting small and simple is an easy way to go. So in like some of my presentations or advice that I give others, if you have to do an email, first off, spice it up a little bit. Don't just send plain text and say,
the meme.
Put a GIF in there, put a meme in there. Just bold text that you want people to pay attention to, or change the color of it. Make this red, make this green. Those are simple ways. For some of the more advanced things, like videos and songs and other things that I've done, you may need to engage with some other creative folks at your organization. I have that music and arts background, so it comes more naturally to me.
Enjoy it.
Yeah, and I love it. Definitely during COVID, it was a great release.
Sure.
Try and have fun somehow in the middle of not so fun.
Yeah.
And there's usually people around your organization. It may not be somebody in informatics or directly in IT, and that's okay. Maybe it's somebody that you grow up. I mean, there's people coming into work that want to be influencers and stuff like that.
You need a company talent show to find out who the real talents are.
Yeah.
You can leverage.
Or for sure. Or just there are marketing and communications folks that should be doing things like this too.
Sure.
I mean, they probably are focused on public side of things, but can they turn internal too?
Absolutely.
Yeah.
You mentioned one other thing that I find really fascinating, which is how do we communicate communicate with them? Is it the email? Is it the internal system? Is it their systems? And I'd love to hear you use Epic InBasket messaging to help educate. What are the pros and cons of leveraging that to educate clinicians? Because that's a little dicey, a little overwhelming.
Oh, for sure.
But if you do it right, it can be really effective because they're living in that, right?
Absolutely. And I think that's kind of one of our philosophies at Parkview in general is, one system. We have Epic, can we integrate as much as we can within Epic to keep people within one workflow to be as efficient as possible? So we use a special InBasket message folder. They call it broadcast message. And we decided that we were going to use this as an informatics communication tool. Nobody else uses it. So we kind of internally took that over.
Nice.
We did make some kind of our own rules of the road for utilization of broadcast message. So like maximum 2 messages per month. Keep it short. And if there's additional information that needs to be in there, link it out to, something else on SharePoint or wherever else that we can house that information. But InBasket is a workflow that people are used to going to. So, and it's its own separate folder that you can skip over if you want to. We have the messages auto-delete in, a week or so. So it'll be out of there soon. I can totally see though, my InBasket is flooded with messages. So why send something else there? Well, I think some of these guidelines that we've adopted help in that direction. I also try to get those emails or InBasket messages out at 11:55, right as you're winding down for the morning. So maybe it's something you look at lunch. Because there's also an art to the timing of messages too. All those HR emails come out on Friday at 5. So, but yeah, the ones that they don't want you to respond to over the weekend, whatever. But no, for providers, I think they take that lunchtime to catch up on their InBasket. Mostly. And I don't want to add something to their workflow at the end of the day either. So right about that lunchtime is that sweet spot. So
that's good advice.
Yeah.
Did you send your infomercial Epic InBasket or? Or was that an email?
The infomercial that was 5 years ago now. So almost. So I honestly don't remember. But yeah,
that's awesome.
But yeah. So since it was our first, I was probably still learning, some of this
I'm
stuff.
Sure.
So yeah.
Well, Mark, we always like to wrap up these CIO podcasts with a little career advice.
Sure.
And talking career perspective.
Yeah.
What advice would you give to other CMIOs out there?
One of my big advice moments, I would say, comes from a kind of personal flaw that I tried to overcome myself, and that is to get yourself out there. There have been times in my life that I have regretted not speaking up and not volunteering for certain things or not doing things that I was perfectly capable of doing, maybe because I was, afraid of backlash or whatever. But I think it applies, to life in general, but also to CMIOs. So get yourself out there, make that meeting with your executives, share that information at a conference. Go up to somebody at a conference or, make a connection at your EHR vendor with somebody who's ask for a mentor. But a lot of us in informatics are very introverted. I am myself too. But I make myself get out there, put myself out there. And after some lessons learned, do it. And, what's the worst that could happen? So
brings a lot of benefits. I find it funny that you said you're an introvert, but you have a TikTok channel with these videos, which doesn't feel very introverted. And I like that you didn't say go start a TikTok channel. You said put yourself out there and take those opportunities to share. Yeah,
there's many different ways of doing that. And even the public speaking thing, it totally exhausts me, but I need to get it out there because I do, think it is good for me, good for my health system, sharing what we've done as well. And I just think it's good advice for anyone in general. So.
And for those that want to follow you on TikTok, what's your TikTok account?
At Dr. MK, DOCTR MK.
Awesome.
So, yeah.
Well, be sure to like and subscribe on TikTok, as the kids say. But Mark, this was awesome. I appreciate your creativity and your approach to, learning can be such a drag for so many, and we've killed it in so many ways because we've made it a drag. And so I love seeing creative ways to approach educating and learning. So thanks so much for talking with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks, Mark.
Thank you so much.